All right, so I'm tremendously excited to have my good friend and colleague, Dr. Dan.kadrmas, here with us. I've known Dan closely for about a decade, worked closely with each other, memorable conversations, and I'm so excited that he's here to talk about multitracer PET imaging. You may be surprised some of the audience to hear this term because we normally think that SPECT imaging you could do multitracer because you could have different isotopes emitting different energies. But how on earth are you going to do multitracer PET where everything is 511 kV? But that's exactly what we're going to talk about today. So Dan, I'm just going to ask you first to introduce yourself a little bit, and then we'll get into the discussion.
Okay, great, Armand. Thank you. Yeah, and I really appreciate the opportunity to be here. I've been at the University of Utah for 25 years and just retired to emeritus professor to put my energies into my startup company, Multifunctional Imaging, where we're actually trying to commercialize multitracer PET technologies and make them available to people. And so...
Yeah, I'm just so excited to have you here. Like, there's multiple things. I really want to talk about how on earth you're going to do this, because in PET you have 511 kV, no matter coming from no matter which isotope you use. But before we get into how on earth, let's talk about why on earth we would want to.
Yeah. So one of the really neat things about PET imaging is there's literally been thousands of different PET tracers that have been studied in the research world. So things looking at glucose metabolism, bone formation, blood flow, dopamine receptors, neuroendocrine tumor receptors, proliferation, hypoxia, perfusion. I mean, literally thousands of PET tracers have been studied. And this has been going on for maybe 4 decades now. One of the interesting things, though, is very few of these tracers have been FDA approved and are being used clinically. And one of the main reasons for that is each tracer has typically been evaluated as an individual diagnostic marker for whatever clinical task. However, over the last maybe 20 years or so, there's a pretty large and growing body of research with these other tracers that show that if you could image more than one tracer in a patient, you can obtain different and complementary information that can definitely improve diagnosis, staging, for example, characterization of disease, and whatnot. As you said, of course, in SPECT, you can use energy discrimination to image multiple tracers.
We've learned that traditionally, right? You put the energy windows around those particular isotopes, and there you have it, right? I mean, of course, it's not that straightforward, but in PET, it's all 511 kV. How are you going to do this?
Yeah. So so with PET, typically you've had to do separate scans on separate days, which is very expensive. It's not practical. It's inconvenient for the patient. And so what we want to do is try to image that in one scan. And I think this slide here explains what you were just saying is with PET, your conventional PET signal is you're detecting 511 kV photon pairs that come from a positron annihilation. So regardless of what tracer emitted that positron, it's going to create a 511 kV pair. So unlike SPECT, where you have different energies for different tracers, in PET, you always get that 511 kV pair. So the problem is when I measure the PET scan, I'm getting a bunch of counts, and I don't know which count came from which tracer is the fundamental problem for trying to image. Well, it turns out that there's a generalized approach that the first parts of this were first proposed in about 1982. And then in the late 90s, a couple different groups started doing some more work with this. And essentially, it turns out that different PET tracers have different kinetic behaviors. So the way that the tracer distributes through the body and is taken up in tissues is different. And so if you do staggered injections, so instead of administering 2 PET tracers at the same time, if you administer one tracer, wait some number of minutes and a second tracer, and then perform dynamic imaging, so essentially acquire a movie of the tracers distributing through the body, you actually have some information that allows you to distinguish essentially what the contribution of each tracer is to the image.
So in a sense, can I say that it's not just about physics, because if physics is not helpful enough, you're also getting help from the biology, the kinetics, the redistribution of the radio tracers.
Exactly. Yeah. So ideally, we'd like to do this purely with physics because it'd be the most direct way to do it, but unfortunately, that doesn't work. There's a caveat there, though, that a few years ago, a couple groups recognized that certain PET tracers also had what they call a prompt gamma. So in addition to the positron, they emit another photon. And so they can actually do like a triple coincidence with that photon. And so they can do dual tracer imaging with tracer pairs. The biggest challenge of that is you're required to have one of the PET isotopes with the prompt gamma, which greatly limits the tracer pairs that you can study. So I'm going to talk more about this generalized approach with staggered.
Yeah.
Mm-hmm. Yeah.
Yeah, so I think one of the questions that happens is, what are some of the, okay, so we're sort of getting a sense from you, and I think there's beautiful mathematics I've seen in some of your papers where you talk about how you can sort of try to attempt to do this. What are some of the considerations or, things that we have to be specifically tuned to, in terms of doing this for different applications?
Yeah, great question. I think by far the main consideration is that different tracers have different kinetics and different half-lives. Mm-hmm. And the performance of any sort of multi-tracer imaging is going to depend on which tracers you use, where you're imaging in the body, how much activity you inject with each tracer, the order and the timing of when you administer the tracers, and how long you scan, so on and so forth. So unfortunately, we do not have a single approach that you can then apply to different tracer combinations and trust that it's going to work. It's critically important to optimize each of those parameters for every specific tracer combination. And then the other thing that's important.
By the way, if I make a comment there, I think that I totally agree with that in general. Like often, sometimes we take something, off the shelf and we do it, and it sort of works, but it's not optimized. And then over time, people become disappointed with that thing. So we got to make sure we're sort of doing the best that we possibly can for that, particular application.
Yeah. And then the other thing to remember is you're probably not going to get exactly the same result that you would get if you did separate single tracer images with each tracer. And so in general, if you're doing multi-tracer imaging with a well-designed approach, you can usually recover a static image, so an image of the tracer uptake accurately. SUVs, so standardized uptake values, work pretty well. In general, the K1 parameter, which often correlates with blood flow, and the net uptake parameter are recovered pretty well from these protocols.
Right.
However, if you're trying to look at compartment modeling with some advanced high order rate parameters like a K2, a K3, or a K4, this tends to not work very well. And in that scenario, you're probably better off doing single tracer imaging of that tracer if you need those micro parameters. But those kind of broader things, you tend to recover pretty well.
So it's kind of interesting. So I can sort of see that then why, for example, in your own work, you're focusing a lot on, for example, SUV, which is kind of an interesting thing, by the way, where you're doing kinetic modeling stuff. Your final product may not even be a kinetic parameter, it may be SUV, but you're benefiting, which is kind of unique, you're benefiting from kinetic modeling in order to do dual tracer SUV, for example.
Absolutely, yeah, it's really a unique application of kinetic modeling.
Yeah.
And where, in general, if you're doing kinetic modeling, your end goal is to measure those rate parameters.
Yeah.
And in our case, that could be an end goal, but the broader goal of separating the images of each tracer is our end goal, and we're using kinetic modeling to get there.
It's almost doing this thing in the background, and it's kind of unique, actually, unique application of kinetic modeling. Yeah,
it's a great insight.
Yeah.
So the next two slides, this is really busy, but I kind of want to walk through the generalized approach to doing, in this case, a dual tracer imaging with FLT and FDG. So this would look at proliferation and glucose metabolism of a tumor, for example. And so the main point is you're going to do dynamic imaging. So you're going to inject the tracer and then acquire a movie as the tracer is taken up in the body. And with the dual tracer approach, you might inject FLT at time 0, wait 20 or 30 minutes, and then inject FDG. And if you look at the data that you get, what you're actually getting is you're getting single tracer data for that first time period until the second tracer is administered. And then after that, you've got dual tracer data. And so what this allows you to do is characterize the uptake kinetics of the first tracer very accurately. And then hopefully that model is sufficient to project forward or extrapolate those kinetics in time. And that would allow you to essentially estimate that component,
Yeah.
and then correct for that as you're trying to model the second tracer. And so,
so you may not actually be doing this, but in a sense, you would be subtracting. I mean, you may not really be doing it like that, but you may essentially, you're kind of subtracting that tail of the first part, and you sort of then allowing you to do the second part, right?
exactly, yeah. So conceptually, you could think of it as estimate tracer one, subtract it, and then estimate tracer two.
Yeah.
It turns out when we do these studies, though, that in general, if you do the modeling of both tracers simultaneously, it behaves better in noise. And noise is the #1 problem that limits these approaches.
Yep.
So the actual approach tends to be a combined modeling approach with both tracers or even 3 tracers, which gets very mathematically intensive. But conceptually, you're still kind of doing the same thing where you're trying to estimate the components of each tracer, so then you can pull them apart and look at them individually.
Right.
Yeah.
Right.
And then this is another busy slide. But what I'm showing here is just, if you remember, I talked about what your end goals are. They might be images, they might be SUVs, they might be rate parameters. And so for this example, I'm showing a bunch of scatter plots where we're looking at here the SUV for that FLT tracer recovered from dual tracer imaging compared to the single tracer, which you might call truth.
Yeah.
And so you can see there's a very strong correlation here.
Right.
So I would say that the SUV is accurately recovered for FLT and very, very accurately recovered for FDG here.
Yeah.
The net uptake parameters, very similar. It's very accurate for FLT and almost perfect for FDG. And it turns out in this case that the individual rate parameters were also pretty accurate for FDG.
The KNet is, Dan, is the Patlack slope. Is that what it is?
Yeah, the Patlack slope,
Right.
The net uptake, or the net influx. So it's got lots of different names.
Yeah.
Some people call it KI. We call it KNet.
Yeah.
But then if you look at like the FLT K2 and K3 parameters, they are not well recovered from this approach. So if your goal was to measure, say, the SUVs and net uptakes of these 2 tracers, this approach would work very well.
K1. Yeah.
If your goal was to measure K2 or K3 of FLT, this approach would not work well. So this is an example of some of those considerations we talked about a couple minutes ago.
So Dan, let me put you on the spot. This is kind of a weird question, but you're talking about dual tracer. What about multi-tracer? What about, is there any hope for, 3 tracers at a given?
Yeah. So the short answer is yes. The longer answer is, of course, it gets harder every time you add a tracer. I think in reality, in practice, for research, O15 water for cancer research is a great tracer for measuring blood flow. And one of the beautiful things about O15 is it's a 2-minute half-life tracer. So it's very fast to image. So in this case, if you wanted to know the tumor perfusion as well as the FDG and FLT, you probably could have administered O15 water, say at this 1-hour point, and done a triple tracer imaging. So I think that type of scenario would work well. I think in general, 2 tracers is challenging. 3, I think in general would be very challenging. But I do think there are specific cases where it would be useful. Yeah.
I think as the community opens up to the possibility of moving from 1 to 2, let's get there, and then we can think about doing more. Okay. So you were talking about some some of the sort of concerns or considerations, right? Can we say that 2 signals happening in the same session is the exact same as a summation of 2 signals happening at 2 different sessions, for example?
Great question. Yeah. So I would say primarily yes.
Okay.
And the reason I can say that is PET scanners, modern PET scanners are really good at correcting for things like dead time, random coincidences.
The nonlinear ones are the concerns, right? Because summation, those are the nonlinear things. Dead time and randoms one would immediately say. But you're saying that.
Yeah. So since the modern PET scanners are good at correcting for those things,
Yeah.
the image that you get is almost exactly the sum of the individual tracers. And so most of our processing is treating it as a sum of individual tracer images and trying to pull that sum apart. It turns out for things like dead time and randoms and scatter, as long as that is linear over the activity ranges, those corrections are accurate, then that holds true. There's some subtle effects, like things that have to do with the positron range and the spatial resolution.
Like using
that,
two different isotopes with different positron ranges. Yeah.
Exactly.
That's almost secondary. That's almost a very small effect, I think.
Yeah, it's a very small effect. If you wanted to do this perfectly, it's something you'd have to account for. It's not something that we've been focused on yet. And we have a lot bigger problems to address before we start taking on those small things. Oh, and one more thing we probably should consider is the effects on radiation exposure as well. So anytime that you're thinking about administering 2 or 3 PET tracers, you're getting cumulative exposure to the patient. Of course, if you're doing those 2 tracers anyway, that exposure would be the same. But I think in some applications, we may be looking at doing 2 tracers instead of 1, so there will be some moderate increase in radiation exposure.
In fact, compared to 2 separate scans, in fact, if anything, you're doing 1 less CT, right?
Yeah, so
if you were doing
you can image 2 tracers anyway, but do it in a single scan, you can do a single CT and reduce the CT exposure, which is often more than the PET tracer exposure. So that's a good point.
But though the CT ones are also becoming less and less in those, I mean, it depends. But if compared to one set, you're comparing to 1 session, 1 single tracer, sure, it's could be more radiation exposure, but then the value could be tremendously higher and totally justify that. So
absolutely.
Okay. So what are some of the applications then that you sort of
so there's a lot of possibilities here. Currently, only one is being used clinically. The low-hanging fruit when we first started doing this with rest and stress myocardial perfusion PET. It's not really dual tracer because what you're actually doing is injecting the same tracer twice.
Under 2 conditions.
First under rest condition, then under a stress condition. But this was really the first product that my startup companies put out there, and it's currently being used clinically.
What kind of time savings are we talking about here?
So if you're doing N13 ammonia, typically people would do a rest scan, depending on the site, maybe for 10 to 15 minutes, and then take the patient off the scanner, put them back in the waiting room for up to 90 minutes, and then bring them back, reposition them on the scanner, and then do the stress scan. So a total procedure time, which was probably 90 minutes to 2 hours, you can now complete in 15 to 20 minutes completely done. So it's a big improvement for throughput. Patients love it because they're in and out instead of being there for hours. There are several other possible cardiac applications for dual tracer PET. For example, looking at perfusion and viability, so using FDG for viability with the perfusion tracer. Both of those scans are being done clinically separately today, so there's a possibility of making that a simultaneous approach. And also using a perfusion tracer with FDG, but now using FDG to look at inflammation for things like cardiac applications. Okay, yeah. And so, the real exciting area that's got a lot of potential applications is multi-tracer assessments of various markers in malignant tumors, so cancer imaging. So we have the potential to look at blood flow, metabolism, hypoxia, proliferation, and other tumor markers simultaneously in a tumor.
And diagnostics. I mean, this is all exciting to me. I mean, as we think about, in existing clinical trials, for example, in theranostics, people are doing, for example, in some clinical trials, doing FDG and let's say dotatate, for example, for neuroendocrine tumors, right? You're doing multi-tracer imaging different sessions, of course, but can you combine those into a single session? And and the reason this excites me, Dan, is because as we think about optimizing radiopharmaceutical therapies, possibly building digital twins for our patients to try to really personalize how much we're going to inject, into our patients and how we're going to do it. I think having more and more information before the therapy session and to build these models and digital twins is going to be important. So doing multiple tracers on our patients, to me sounds pretty exciting.
Yeah, no, that's a great point. Yeah, the application of FDG and dotatate in NETs is a perfect example of what we're trying to accomplish. I've talked to oncologists about that specific thing, and they currently would like to image both FDG and dotatate in all their patients, but the logistical problems of doing it in 2 scans means they're generally selecting one or the other for these patients. And we could actually improve the care that these patients get by enabling them to have both of those tracers.
That's pretty exciting. Yeah.
And of course, there's lots of other exciting possible applications, like in neurology, looking at both. If you could look at amyloid and tau at the same time, and even if you could do that and then add metabolism perfusion in the brain, it'd be a unique new tool to look at diseases, as well as lots of other applications in other areas. So,
as I like to say, the future is bright, and I think if we have an open mind and bring together these capabilities and these technological and computational skills and tools that can be developed. Yeah, great. So tell me a little bit more. I know about your company and the product that you mentioned also with the rest stress, but I know you also have a sort of a research tool, for example, that you're sharing, with different people. And tell me more about it. What does it do?
So multi-tracer PET is hard. If you're trying to do combined modeling of 2 tracers, that there's a lot of math, a lot of challenge that goes into that. And I think it's one of the things that's held back research around the world is just the ability to simultaneously model, do kinetic modeling of multiple tracers is very challenging to take on from scratch. And so kind of as an extension of the research I've done at University of Utah is we've built a lot of our tools that we've used over the years into this research software package that we call MF Evolve. The main features it has is the ability to simultaneously fit compartment models for up to 5 tracers and using a model up to 2 tissue compartments with 5 rate parameters. And these fits are very fast and robust. So it solves one of the big challenges of trying to do research in any of these possible multi-tracer applications.
I remember
the software also has.
Sorry to interrupt. I remember I was really excited. Years ago I was attending a talk by you. This is before you did your startup, and you did this presentation. These are non-linear models, but you had managed to linearize them in a very smart way, and that's why they're super fast, I think, and robust.
Yeah. It's a big advance, I think, because when we started doing these multi-tracer fits, we literally would run a fit for about 6 weeks to fit 1 time activity curve. So we'd run it on an array of computers for weeks, and we've got those times down now to well under a second for a single curve, and we can often fit every pixel of an image in a few minutes. So we're really excited about that. The research software, it's got some built-in tools for doing multi-tracer PET signal separation, and then some general analysis, display tools and ROI tools and whatnot that you might expect. And so I do want to point out this is for research use only. While it is a product for our company and we're selling it for a nominal subscription fee, it is not something that's ever intended to be profit generating. We want to enable other groups to look at their own multi-tracer PET applications and develop, hopefully lots of wonderful new applications with tracers.
Oh, that's great. That's wonderful. So Dan, thank you very much for being here. And again, I've been following your great work over the years, and it's great that it's products are being made, and I think there are great applications in the horizon. And again, you mentioned things that are already here, such as REST, but again, moving towards other applications such as in oncology, theranostics, many things in the future. So you know, for the audience listening to this, I know there are a good number of people who could be, you know, making these major developments of the future. So thank you very much for your time, Dan, and let's keep in touch.
Great. Thanks for having me. Bye-bye.
Thank you.